In my presentation, I will be discussing substance use in adolescence. With substance use being one of the worst public health issues in America, with more than $7 billion costing more than $7 billion each year. There's over 2 million reports of substance use, and over 1 million that report are in need of treatment. According to Mack, Russell, Lanza, Feinberg, and Fosco's article, Age-Varying Associations of Parental Knowledge and Antisocial Peer Behavior with Adolescent Substance Use, the past month, substance use was minimal at 11 and increased across adolescents. Before age 15, past month cigarette use was the most common, followed by drunkenness and then marijuana use. The frontal striatal portion of the brain contains the cerebral cortex, the basal ganglia, which promotes movement and reward. There's the thalamus, which is the sensory gateway. The hippocampus holds your memory. The amygdala, which regulates emotion. The hypothalamus regulates body function. So the frontal striatal portion of the brain in full moderates brain functions. The dysfunction in the loops lead to a wanting dominated state, and addiction is said to be viewed as being in that state. Neutral circuits control the process, and the maturing of neutral circuits in the brain makes the brain more susceptible to the effects of substance use. Distribution is greater when long-term use starts in adolescence. When adolescents start use early on, they have a prolonged exposure, and they are determined to be more frequent users later on in age. In their article, Deficient Functioning of Frontal Striatal Circuits During the Resolution of Cognitive Conflict in Cannabis Using Youth, Sear and Tao et al. State, adolescents could be particularly vulnerable to the effects of prolonged exposure. Because of the ongoing development of frontal striatal circuits and associated cognitive functions, previous findings suggest greater disturbances in frontal striatal process in long-term cannabis use adults who become more frequent users at younger versus older ages. The disruption of self-regulatory control decreases control over addiction, which leads to the impulse of drug use. Another factor in adolescents' use of substances is the parents' use. According to Sir et al., Beyond the Self and Self-Regulation, Family Interaction Modulates Situational Self-Control by Adolescent Drug Users. Parental substance use may lead to problems among children in a number of many different ways, including via increased availability and access to substances in the home, modeling, and the message that drug use is an acceptable norm. With parents being in this current state of substance use, it is highly probable for the child to begin the use of substances. Postnatal parenting marijuana use. Leads to children being more likely and beginning to continue to use. They're also less likely to use positive parenting, which also leads to greater risk of child substance use. Parents who report use in their teens send a message to their children, creating a positive norm for substance use. According to Epstein et al., although current use is an important risk factor, for child health. Parents' history of marijuana use poses additional risks, particularly for marijuana use in norms. Prevention programs that are specifically targeted for marijuana using parents need to be developed to include messaging regarding how parents can discuss marijuana and other substances when they are users themselves. All prevention programs need to address parents' history of marijuana use and how it may shape parenting strategies around adolescent marijuana use. Parental knowledge is vital to foreseeing adolescent use. Low parental knowledge leads to the unawareness of activities allowing for the child's advantage to use. Parents typically are more aware of adolescent use in earlier stages than in later stages. Patterson's 1989 developmental theory, ineffective parenting, suggests that ineffective parenting leads to problem behaviors, and rejection by peers results in antisocial peer behavior relationships. This is likely to coerce substance use. Hurt et al. In their article Intergenerational Congruence in an Adolescent Onset of Alcohol, Tobacco, and Marijuana Use as a Way of Coping with Negative Emotions. Calder et al. Suggest that such interventions could catch adolescents and young adults in moments of distress and accompanying increases in coping motivations, providing feedback and alternative coping strategies that could be effectively employed during periods of greatest risk as they occur. Substance use disorders interventions focus on decreasing negative emotions and increasing positive emotions. Because low levels of positive emotions predict both increased motivation and relapse, it is vital to increase positive emotions to protect against emerging into substance use. Emotional distress is key in the development of substance use disorders. Patients are often experiencing high levels of negative emotions. In the article, a meta-analysis of the effect of substance use intervention and emotion outcome, Kang et al. States, findings suggest that substance use disorder interventions, especially mindfulness and self-regulation treatments, are indeed significantly negative. Early-stage substance use is related to an adolescent's lack of self-regulation, control, and problem-solving skills. An adolescent's level of performance in school may be related to their level of delinquency and substance use. The results of Griffin et al. Studies suggest that personal competence skills may be important precursors for the development of positive outcomes during early adolescence, and that one way that competence leads to positive outcomes is through promoting feelings of personal satisfaction and well-being. Teaching self-management and social skills to diminish the exposure to social influence promoting substance use is very important in preventing or in enhancing competence, as well as personal motivations to engage in alcohol, tobacco, and marijuana use. It is also important to teach life skills as a way to strengthen competence and develop feelings of self-efficiency and well-being. In order to self-regulate, one must use multiple emotional, cognitive, and behavioral strategies during stressful times to equalize one's attention, thoughts, emotions, and behaviors. Self-regulation poses as a protector against delinquent behavior in adolescence. The inability to Identify and maintain a goal-oriented thoughts and emotions toward the environment is a main factor in adolescent substance use. Structural family therapies for adolescent delinquency and substance use suggest interrupting patterns of negative interaction is significant in producing positive change. Epstein et al. Found that adult chronic substance users who used during adolescence were less likely to graduate high school, complete a college degree, or be employed compared to non-users. According to Epstein et al., children of parents who used during adolescence had a 2.5 to a 4.4 times higher probability to use marijuana, 1.8 to 2.75 times higher probability to use alcohol, and compared to children of non-users. Having parents who were chronic users led to greater chances for adolescents to become cigarette users and confide to pro-marijuana norms, present problem behaviors. In addition, it is believed that adolescents detaining low levels of competence indulge in substance use as an aid to fulfill what their self-management and social skills could not. Mindfulness intervention encourages clients to pursue enjoyable activities throughout all areas of life. The objective is to increase feelings of joy, warmth, and serenity. It is also important to increase the awareness and the acceptance of substance use and to focus on the good in life. Mindfulness intervention also provides healthy coping skills and helping their clients embrace life experiences rather than to suppress their experiences. Mindfulness intervention also teaches that it is important to notice and accept the cravings to regulate the mixed emotions that their clients have towards their substance use. In their article, Kang et al. States, results indicate a significant effect of substance abuse disorders intervention in reducing subjective feelings of negative emotion. Then they go on to ensure that this kind of treatment is highly effective as well as crucial. Health issues in America. In conclusion, substance use is one of the worst public health issues in America. There is evidence that substance use in adolescence is brought on by psychological as well as environmental and societal factors. The frontal striatal portion of the brain consists of the control processing. The disruption in the neural circuits maturation leads to the brain's acceptance to substances. It is also apparent that genetic factors as well as parental modeling play a role in adolescents' engagement with substances. Parent substance involvement portrays substance use as a positive norm. It is vital for parents to have strong, effective relationships with their children and for parents to relay the effects of substances with their children. With adolescents looking for an escape from the negative emotions in their life, they turn to substance use as a way of coping. It is important to teach children healthy coping mechanisms and effective social skills to reduce their likelihood of being engaged in substance use. The lack of intelligence may also cause a child to feel worthless and meaninglessness. When children feel this way, they are more susceptible to turn to substance use as a way of boosting their confidence. Teaching life skills is a way to strengthen competence skills. And this is very important because it will help enhance a child's well-being. In addition, juvenile offenders are at greater risk for continuing use. Prevention as well as intervention are key factors in reducing adolescent substance use and involvement.